Hello friends, today we want to talk about iodine. People can get depleted with iodine as of common symptoms as the toxicity of the fluoride increases in the body. In clinical practice, we have seen a lot of people coming with joint pain or pain in the calf or other parts of the body which is not going off irrespective what we have done to them. On deeper assessment, when we talk about the other symptoms associated with it, we see that the client is more prone to iodine deficiencies. Or they have enough iodine but they are not able to process it. Or iodine synthesis is poor because of the lack of other nutrients. Nowadays, we see almost most of our clients are thyroid positive and their production of iodine is very low. The body is not able to produce it. And lacking to identify why into it, people don't want to go into it. They just want to take the medicines and help themselves. But it doesn't last very long. The dependency keeps increasing and the muscle issues also keep increasing. So today we're going to see some overall aspect of iodine in the body and try to see if we can help our client in identifying how their pain is related to iodine. So iodine is an essential element used in the thyroid. Human cannot produce iodine, so it needs to be consumed from our body. So we cannot synthesize it directly. It needs a lot of direct external support. Iodine is an essential component of thyroid hormone T4 and T3. That is what is converted into iodine. Iodine is taken to prevent and treat iodine deficiencies and its consequences including goiter and thyroid disorder. Iodine also used for pink eyes, gum infection, wound healing and many other conditions. So wherever we find the infection, the bacterial growth is there, we can use iodine as a topical devices to help us not to get infection. If you remember, the most common thing that we know of, any dressing that we do, we use betadine commonly or povidone, and that is iodine. Povidone, betadine, all these have iodine in it. And that iodine helps not to get any bacterial growth, and that is where we get gum infection, pink eyes, wound healing accelerates. Iodine can be bound to amino acid or it can be free, usually in the form of iodate or iodide ions. Iodide is the easiest form to absorb so that the bound iodine and iodide converts into glutathione. The iodide ions are easily absorbed to the walls of the digestive tract, stomach and small intestine is the fastest way to do it. After it's absorbed, the most of the concentrates in thyroid gland. Some is accumulated in the ovaries, skin, salivary, gastric and mammary glands. So these are your storage, and we commonly see skin as a storage too. So when we are finding it hard to absorb through the gastro issue, because if you have a gastric issues, absorbing through the small intestine and stomach again reduces the bioavailability of the iodine. So we can directly give it to the skin by oral topical application, and that gives the more bioavailability because it's a storage system and body is going to take it from it as and when needed. So that is where we commonly use a topical application to increase the more bioavailability of iodine with lesser concentrations. So I've seen clients who are on thyroid and they are taking the thyroid medicine, but still the body aches are there because the body is not able to absorb that much because of their gastritis issues, or I can say IBS or other symptoms which are so dominant that the absorption of iodine is again limited. The use of the iodine is promote thyroid health, reducing goiter, neurodevelopment in pregnancy, cognitive functions, maintain energy levels, how awake you are, how energetic you are, regulates oral metabolism, body temperatures. So vital functions of the iodine is to help you regulate adrenals. When we talk about regulate adrenals, we mean by stress corrections. So if the body has a lot of stress and that needs to be regulated, you need proper amount of iodine. As your stress increases, the iodine dips. So as our everyday body mood swings, today I'm happy, tomorrow I'm sad, things just go haywire, and the more the add fluctuation to the stress, iodine also needs to be fluctuated. So people who are on low iodine and they are under constant stress, the iodine demand will increase because body can produce it. And if you don't have enough storage, then always you'll be low on the symptoms. You'll be high on symptoms, low on availability. So temporarily, we give them the external supplements, or I would say just skin applications, to see if they can get a change. We recommend them to go to the doctor and find the proper medications for that. So if that is helping you, it can be temporary. If you're using it as a temporary phase, you can just do an topical application and see how you feel better. Or increase the iodine-rich food that can help you also get better into that system. And liver, pancreas, sex hormones, it gets into function to it. It reduces cholesterol if it is good level. Helps to improve energy level, just like vitamin C. It's an antioxidant throughout the body system. It is very important for our metabolic rate because it controls the heat in our system. It is good for anti-aging property. Mainly it kills candida. As we have seen nowadays, people are typically have increased their food diets on fermentations. And most of our food available in the market are fermentations. We have seen them on the symptoms of candida, where they would be irritated and bowel issues and aches and pains and random in the body, and they cannot point out how the symptoms goes from memory loss to wide varieties of symptoms. And these candida people are more prone for pain. And as I've talked before, just before when we started this iodine topic, that iodine kills bacteria. So if you're low on iodine, these candida would ferment in your body like anything. They'll thrive. The more they thrive, the more IBS issues or candida-like symptoms can be noted. Candida-like symptoms, we'll talk about them shortly. These huge varieties of symptoms can affect your thyroid functioning to liver, glands, social, mood, and the symptoms are so vague that they are hard to point any disease to them. And that is when we term them as candida as the symptoms. So candida is a fungal infection caused by candida and is more lives on the skin inside the body, places such as mouth, throat, vagina problems. Usually females complains of urinary tract infections, vaginitis. Oral thrushes develops white bumpy patches on the tongue, cheeks, tonsils. Tiredness and fatigue is the most common one. They're always tired, always fatigued. Recurring genitals and urinary tract infections, digestive issues, sinus issues, skin and nail functions, and joint pain. So I commonly see is joint pain, skin nail fungals, digestive issues, always under stress, always urinary tract infections, general issues, tiredness and fatigue, and I see that body is thriving with candida. They can see those things falling in their eyes, which there is nothing in the air, but still they will see things are falling from their eyes, and that is where we see the candida is positive. And as soon as we start with iodine, these symptoms reduces. So we are not starting more of TSH, we are asking them to can get that iodine evaluated with them and see if their body has enough to absorb and assimilate it and digest it for the process. If they, as I said, if they have a poor digestive tract, you cannot absorb iodine from there. So you might be taking iodine tablets, but their body is not getting enough. Might have to go with a patch iodine rather than the orals. Candida is capable of killing all types of pathogen, bacteria, virus, fungi. In fact, 90% of most of the bacteria is within 15 to 30 seconds. So powdered in iodine paint was used in 13 patients who prone fungal infections, of which 7 out of 10 patients either improved or cleared up completely within 7 days, another 3 with fungus. Adrenal hormones in iodine change in diet and the lifestyle behavior that leads to alteration in coping skills, cortisols, insulin, and thyroid levels, which result in fatigue and slow metabolism. The receptor of these three hormones located in nearly every cell of the body, the relationship between adrenal, thyroid, and pancreas is critical for energy production and balance physiology. To keep you alert, to keep you awake, to keep you working, you need more of these adrenal functions. And the lesser of these two function, the lesser the thyroid would be, the lesser the adrenals would be. More fatigue, tiring, you couldn't do things completely, you won't be focused, things will not go in your favor, you need more of rejuvenating time for the body. Clients with adrenal dysfunction can come up with can't stay asleep, fatigue, salt sugar craving, allergies, headaches, ulcers, irritable before meals, Need to eat to relieve fatigue, ulcers, blood visions, dizziness, asthma, varicose vein, hemorrhoids, pay for caffeine in cigarettes, blood visions. So these are all adrenal symptoms. And somewhere or the other you see that they are not having enough energy, and to cope up with the energy they might have to eat more with sugar cravings, and because of that they might have to eat more of other things, crave for cigarettes. So they need something constantly so that the body can be up. They can be caffeine dependent, they can be other dependents, because they want their body to be up because the adrenals are not able to cope up. And adrenals are not able to cope up because the body cannot produce enough thyroid into it. And they end up being on thyroid. Iron deficiencies and sleep goes hand to hand. The most basic function is called insomnia and weird feeling and late at the night. They can't regulate their sleep cycle. They don't feel like going to deep sleep. They go to sleep, they wake up, they can go to sleep, they can wake up. Underthyroid low conditions which causes blood sugar levels to drop, so the body can also have blood sugar levels, and they would crave foods which should not help them a lot. Glycogen is where the liver stores the body, and the blood sugar is regulated stable at night. It makes it difficult to go to sleep and stay asleep as well. So you won't have enough glucogen at night because it's not able to process it, and if you not have enough glycogen at night, you won't be able to sleep because you don't feel satisfied, and your blood sugar drops and the stress response increases, and you eat up more negative things before you sleep. Does iodine interact with other nutrients? Yes, several minerals and trace minerals depends on iodine and their metabolism. Example, iodine, iron, selenium and zinc coexistent deficiency of these elements can impair thyroid functions. So usually we see iodine deficiency in zinc, selenium and maybe the iron. If you are low on iodine, you are also low on zinc. If you are low on iron, you are low on iodine. If you are low on selenium, you might be low on iodine. If you are low on zinc, you can be low on iodine, or vice versa. So they coexist with lower levels of vitamin A, selenium, zinc, copper, or iron can impair the function of iodine in our bodies. So to maximize the iodine function, you need these four, maybe vitamin A, selenium, zinc, copper, and iron. And the lesser they get, even you have enough iodine in the body, it cannot be metabolized. So the proper functioning of the iodine, if you have a proper vitamin A, selenium and zinc and copper you can test, maybe you'll get better results out of it. I commonly test A in selenium, which is the most common one, because zinc nowadays people take it more commonly. And if I doubt I see more symptoms of zinc, I can add that to see if that is really affecting the iodine absorption. However, this may significantly vary from client to client and day to day. So to make the thyroid function proper, you need iodine, but to make the iodine function proper, you need magnesium, selenium, CQ10, iron, you need zinc, you need copper. So it is co-dependent on many minerals. If any of these minerals are not proper, iodine will not get absorbed, assimilated in diet, and you will not be able to get the symptoms. So people say I have low iodine. You might have enough iodine in the body, but you don't have these minerals to absorb, and that is very, very important. So if those minerals makes the iodine test negative, then you would say you need those minerals. If they make it positive, then you might need more. So iodine and ions are essential elements for thyroid function. Iron deficiency impairs the thyroid hormone synthesis by reducing the activity of heme-dependent thyroid peroxide. Iron deficiency anemia, blunts and iron supplementation improve the efficacy of iron supplementation. Selenium works intimately with iodine, precursor of thyroid hormone. Selenium contained thyroid is higher than any other part of the body. It's crucial for conversion of T4 to T3. Copper and iodine is used as a source of dietary iodine. Copper is a table salt. Copper is essential nutrient, but it's moderately toxic in high doses, and they go in hand to hand. Muscle pain and cramps. A lack of mineral in your diet, depletion of minerals in your body can cause you cramps. Iodine is critical for many functions, including the thyroid function. And we have direct correlation between that two. So whenever we see a client with muscle cramps, which is not going irrespective of done what, we start with iodine. A small amount of iodine can change a huge impact in pain. That means client is deficiting of iodine. And that is commonly seen in cramps because what we see is calcium fluoride getting absorbed in the muscle of calf, and fluoride is toxic with low iodine, and that muscle would be low on iodine. And this fluoride, calcium fluoride, is not allowing the calf muscles to move in. and getting moved in, you really need iodine for it. So client with muscle pain with low iodine is going to be joint inflamed and painful. Recombinant joint pain, pain in the bones at night, rheumatism of the nape, upper extremities, colds, hands and feet. So client can complain here, pain in the nape, upper extremities, colds, hands and feet. Pungent sweats of the feet will be quite smelly. Rheumatic pains, constrictive sensations. You feel like the body is constrictive, it's not opening up, and this is mainly at night. Cold feels in all season. Pungent smell in the feet, irrespective of what you do. And pain, it feels like deep in the bone because that is where the muscles are not able to function properly. When thyroid is diminished, you will see both the fatigue and tight muscles, as well as sometimes brain fog, constipation, intolerance, unexplained weight gain, even unexplained infertility. Floral excess can cause iodine deficiencies. Nowadays, we see a lot of toothpaste in which we find excess fluoride. Even the groundwater water that we take it from the minerals are excess in fluoride. And this excess fluoride can reduce your iodine capability, which can give the body aches and pains. Because this excess fluoride is going to get deposited in the body like a calcium fluoride. And this calcium fluoride is rigid mineral, it doesn't get absorbed easily. The only contradictory to the fluoride is iodine itself. So if you are going to have enough iodine, you can easily work on it. And to get in-depth correction of it, start with small dosage, and if that creates a change, we ask you to go to the doctor and make sure you work with it in conjunction so that you find out why it is not working with proper doctor, and it's going to help you to understand this is because of the fluoride access or the nutritional deficiency in absorption, and make you help you better work your thyroid back to the neutral. So excess fluoride causes skeletal fluorosis. Excessive ingestion of fluoride can cause osteoarthritis, rheumatoid arthritis, and that is more common in skeletal fluorosis known as. Client can come to you with repetitive stress fractures, and it's usually misses it. We don't usually get it in the spine in early stages. It gets in the late stage where the client gets inevaluable change. And fluoride acts as induces inhibition of sodium iodide supporter, contributing to impaired iodine absorption and iodine deficiencies. Iodine helps flush fluoride from the body, so the deficiency leaves the body with more fluoride, which has been shown to interfere with enzymes important for thyroid function. So fluoride affects iodine if it goes in excess, and if you give it that balance, it will change something. Breast pain, iodine deficiency commonly leads to breast tenderness and fibrosing breast, cause breast pain. Iodine and thyroid can get affected, secretes by pituitary gland. So absence of the iodine can raise the TSH level and cause thyroid dysfunction. Symptoms are again muscle ache, stiffness, shoulder and hip pain, swelling in small joints, carpal tunnel syndromes. Fetal infant dependent can get affected with thyroid hormone. T4 50% deficiencies can be seen. So a lot of people get TSH high when they're pregnant and they need to go on thyroid medicines. So that's recommended daily around at 150 micrograms in women 19 years and plus and 20 pregnant. And you can get it through fish, table salt, eggs, livers, chickens. I don't know which one suits the most. Dairy, milk, cheese and yogurts are more common. That's the reason we prefer them as the most common one. I prefer it to be the table salts, natural ones. That's easily available. Deficiencies can lead to miscarriage, stillbirth, stunted growth, and cognitive impairments. Symptoms are again, we talked about them multiple times: brain fog, visible goiter, fatigue, dullness, as you can see here. So, multiple pregnancy failure, reproductive, ears deafness, brain fog, goiter. We'll do the testing shortly. Toxicity is like nausea, vomiting, diarrhea, burning sensation in throat and mouth, stomach pain. These are the common toxicity. As you can see, what can affect the thyroid is like stress, trauma, low-calorie diets, toxins like fluoride, liver kidney dysfunction, medications can all affect the T3 to T4 to T3 conversion. Factor increases conversion of T4 to T3 is selenium and zinc. So a lot of people are having low selenium and zinc. They would have a high T4 and less T3. Factors that affect the impurity of efficacy of these hormones are vitamin A, exercise, and zinc. So if they are low, the absorptive ability will be affected. Fluoride can and stress infections can definitely affect the thyroid functioning by reducing the iodine availability. And nutrients like iodine, tyrosine, zinc, selenium, vitamin E, B2, B3, B6, C, and D are needed for balance of the iodine function. So iodine needs most of the nutrients to function well. If one is out of sync, it can be functional, but if multiple goes out of sync, it won't be helping you to be very functional. And we have seen a lot of people with thyroid disorder because this is not in sync or this is not in sync, and we don't see that it's functioning properly. So we're going to have somebody for the testing mode, and we're going to have him lie down for us. So I'm going to take one of the muscles that gets easier to do it, as now you should know it. Match my pressure, good. Reduce it, match my pressure, good. So I'm just going to put the iodine on his body and ask him to match my pressure. Does it make you strong or weak? That makes him feel strong. That means he needs, to some extent, if he's low on it, he might be low on it, and maybe asymptomatic yet. It's the beginning of the symptoms, but he needs some of it. Does that make you feel strong? Good. Does that make you feel strong with this iodine? If I add this, does it make you feel stronger or weaker? Same. That's for selenium. We're going to add vitamin A, make it add more. Stronger or weaker? Stronger. So he might need more of vitamin A to add with this so that the body is able to absorb deeper. So he might have enough iodine, but he's lacking vitamin A to it. If that goes weaker, then he has some excess A, which can make the vitamin iodine go weak for his body. If these are no change, then he just needs a direct iodine, and rest of the nutrients are there for him to create a change. To the best result, we always place a drop or two on the palmar surface of the wrist, and we ask the client to just scrub on it and see if the pain changes in the body anywhere in the body. And if it does, then the client needs iodine. If it doesn't, we just make it a wash and we don't work much on it. So this much will not change the whole physiology of the body, but let us know that the client really needs it or not, so we don't really get a urine test done for it, which usually people do it, get done. Less than 20 milligram in the urine definition tells you that you are iodine deficiency, and if it is more, it's normal. And usually, instead of doing a test, I just do a small test, and if that reduces the body ache, I would just tell my client you need iodine as a supplement. So you better ask your doctors how can they help you. And we have seen a lot of clients getting change in pain with this, and gets easier to work on them rather than working more physical pains. And if I ask them what toothpaste they use and things, and we see that their diet has excess fluoride or one of the other issues, which is making them low iodine. The stresses can be there, or they are low on vitamin A or selenium, whatever comes out. And we ask them to have them as a nutrient, a natural nutrient, or through tablets, whatever they like, so that the efficacy of the iodine can be increased in the body naturally, and they can come back to the treatment. So we've seen the people with chronic pain, like rheumatic leg pain, or where we have seen them having symptoms of HLA rheumatism, but their HLA-B27 is negative, then I might look into iodine as one of the factors that can give you similar pains, calcium fluoride excess, and that can cause the same pain symptoms. So working on small things can create a big change, and working on it gives you deeper one. Clear? So that was for iodine. Thank you.